Breast augmentation, also known as augmentation mammoplasty, is a surgical procedure designed to enhance the size and shape of a woman's breasts. Whether it's to restore breast volume lost after weight reduction or pregnancy, or simply to achieve a more balanced figure, this procedure can provide significant improvements in both appearance and confidence. In this video, Dr. Gary Lawton will be explaining the key factors involved in breast augmentation, including how to determine if you're a good candidate, the different implant options, and what to expect during recovery.
Who is a good candidate for breast augmentation? It involves some social and some anatomic considerations. For the patients that have no sagging whatsoever, obviously, they're good candidates for breast augmentation. Even patients with some degree of sagging, the anterior projection and the surface area of the implant can give you somewhat of a lift and create a very pleasing aesthetic outcome without the scars associated with a proper mastopexy breast lift. So who's a good candidate for breast augmentation from a social standpoint? So if you have lost some volume after a pregnancy, you've got a little bit of a slope to the breast had stretched out during the pregnancy and breastfeeding, and then there's involutional loss of breast tissue, breast implant's perfect to fill out the skin envelope and give you the look that you had either before your pregnancy, or maybe you like the way your breast looked when you were breastfeeding. So photographs of your wish pics are extremely helpful for us to determine what kind of implant, what kind of surface area projection and volume characteristics that we're looking for to give you the aesthetics that make you happy. Another reason that someone might be considering breast augmentation is underdevelopment. So if you've gone through your puberty and teenage years and you just didn't have the appropriate amount of growth that's going to make you happy, breast augmentation is a very simple way to augment what you have. They can be soft, they can be natural, they can have a lot of cleavage. Even at the same volume, many different looks can be created. And we use a process of sizing, as well as you showing me photographs of breast augmentations that you like, as well as breast augmentations that you don't like, so that the technical characteristics of what you find pleasing, I can transfer to you and give you the look that you want at the size that you want. So the way we do our breast augmentations is the most sophisticated technique. We go through the armpit, we have cameras in the wound, I can see everything that I'm doing. We've done tens of thousands of breast augmentations this way. The procedure is very meticulous, and I can get a breast augmentation done with the transaxillary endoscopic approach in 30 minutes, and taking my time and making sure it's meticulously created and no bruising, no bleeding, with exactly the shape that I want to create. In my mind, there's no reason that breast augmentation should be taking 2-3 hours. There's just not that much work that needs to be done. Someone that's taking that long to perform a breast augmentation is not doing a better job, and it's really hard to compare when you're talking about times. In my mind, if you can't do a breast augmentation in under an hour, there's something wrong with the technical capabilities or the techniques that are being used to perform the operation. So when we are determining a size for breast augmentation surgery, there's a lot that goes into it. There are 3D imaging systems that people use. I find them to overestimate the differences from left to right. I don't like the way they work. I think it's although it's a fancy technique, I think it's a moderately crude way to determine a size for a patient. We use sizers. We try sizers on in the office, measure the base diameter of the breast so that the diameter of the implant matches the diameter of the breast, and then give the patients instructions on how to make sizers at home where they're comfortable and they can try them on with their favorite dresses, bathing suits, bras, and they have an infinite amount of time to determine the volume before making the final decision, which, because we have implants in the building and I don't have to order them for you, the final decision about volumes can be made on the morning of the surgery while I'm marking you. So in addition to volume, there are measurements of the implants, ratios of the width of the implant to the projection, subtleties that can be really the difference between an outstanding outcome and just an average outcome. One of the things that we ask the patients is to bring us screenshots of 3 photographs of breasts that they like the way they look and 3 that they don't like, because I can get as much information from the 3 that they find distasteful as the 3 that they really like the aesthetics. So combining the volume with the visual appearance of the breast, I will be able to choose an implant that has the appropriate dimensions that will give you the look that you want at the size that you want and give you an outstanding outcome. So nipple sensitivity after any type of breast operation can be an issue. With respect to breast augmentation operation, we're using cameras. I know where the nerves are. You can't actually see them because they're fine in size. So we stay away from the areas where the nipple sensation is coming from. With the breast lift operation, we're just moving skin around and the breast tissue nipple complex is all intact, so you shouldn't have any change in sensation. With the breast reduction operation, we are taking some tissue off in the area where the nerve is, so there is some risk that you might lose sensation, but it's typically not a big issue, especially with people with large breasts, since the nipple's on such stretch that they may not have normal sensation to start with. So the recovery after breast augmentation is moderately simple. It's not an operation that hurts very much, but we're very aggressive with pain control. We see you the next day after the operation, where we use our advanced wound healing protocols. You need 1 week off from work. You could work from home if you can pull that off. I still want you sitting around the house doing nothing for a week. At a week, you come back, we take the stitches out, we show you how to do the massage, and then it's 1 month before you can do any cardio. Saline breast implants versus silicone. Saline implants are softer, they're safer, they look better, they feel better, they rupture less, they cost less. If you do have a rupture, which is only 3% at 10 years, it's IV fluid. You absorb the fluid, you'll know within 24 hours. They warranty the product forever. You come back, we swap them out through the same incision in the armpit, and you're on your way. Silicone implants off the market from 1991 till 2006. Safety studies started in 2006. Really didn't finish the safety studies. FDA criticized them for doing their own safety studies, and there are some people who testified in court that they were instructed to falsify the safety data. So it's not clear whether silicone implants are safe, whether they're truly FDA approved, but in my mind, saline implants significantly safer, pretty easy decision.